Welcome, my dear friends. Myself, Professor Dr. Rajendra Raghuveer Deshpande from Pune, Maharashtra State, India, would like to welcome you all in my Ayurveda Academy YouTube channel. As you know, I am MD in Ayurvedic Medicine and MD in Ayurvedic Physiology. For paid online consultation, you can definitely contact me on WhatsApp 9226810630. The number is given in the description also. My dear friend, this is the series which is called as a Ayurveda in GP, that is Ayurveda in general medical practice, where we are discussing the different problems, health problems that the patients are coming into our general medical practice, and we are talking about the causes, investigations, and the treatment part. Today's discussion is based on the marasmus. The name of the disease is marasmus, which is called as infantile wasting, failure to thrive. That is because of protein and calorie malnutrition. So carbohydrates are also less and protein material is also less. So this is a problem of undernourishment. In Ayurveda, it is called as apatarpanajanya vyadhi. So dhatu kshayajanya vata prakop will be there. Vata dosha will be disturbed because of the dhatu asarata, hina sarata, rasa, rakta, maus, med, asti, majja, shukra. These dhatus are not well developed. So naturally, there will be weight loss or less weight. According to the age, the growth will not be there. Milestones will be delayed. No muscle will be there. Always there will be wrinkling. Hypotonia of the muscle will be seen. And his face will look like an old man. And that is called as a monkey's face. Remember this word, monkey's face. Very typical of this particular marasmus type of the disease. But basically, there are two diseases which are related with the undernourishment. One is a marasmus, whereas there is a protein and calorie, that means carbohydrate or the fat, both deficiencies or all deficiencies are together, but in the quashu or core. Quashu or core is a specific protein deficiency. But in Ayurveda, it is a dhatu kshayajanya vata prakop, especially milestones are delayed, there is no proper development, wrinkling will be seen, monkey face will be seen. Okay, and because of the less immunity, OJ will be less, and repeated infections, recurrent infections of upper respiratory tract or gastrointestinal tract are very, very common. So let us see what are the causes that are mentioned in the modern medicine, then what can be the investigations that you can do, and also the Ayurvedic prescriptions that you are going to see. First, causes etiology, insufficiency of diet, that is incorrect preparation, unsuitable feeding habits, disturbed mother and child relationship, poverty. Poverty is the main cause. Remember this word, poverty. I think for your concentration purpose, as usual, I think you are always happy with this marking so that the people can concentrate what Dr. Deshpande is talking about. Okay, so poverty. Can you see the cursor, please? Poverty. Poverty is the main cause. Inability to take food properly by the child. When the child is breastfed, for example, local lesion of the mouth like ulcers may be there, stomatitis may be there, vitamin deficiency that makes the ulcers and stomatitis. Okay, then the cleft palate, this is congenital anomaly, tearing of the palate, then hair lip, here cut will be there, thrush, that is fungal infection, chronic nasal obstruction, upper gastrointestinal tract diseases like, for example, pyloric stenosis. This is anatomical problem. So you have to do the sonography, you have to do some investigation that we are going to see afterwards. Esophageal stricture may be there, hiatus hernia, neurological problems like muscular weakness due to the anterior spinal muscular atrophy. These are very rare, comparatively very, very rare. Then facial palsy, brain damage due to the birth injury. Yes, this is very common. That's forceps delivery. Congenital developmental anomalies, persistent respiratory infections. This can make a problem of proper eating. Let us see the further causes of the marasmus, that is wasting, muscular wasting, loss of muscles, weight loss will be there, lack of digestion, achlorhydria due to the chronic infection. Hydrochloric acid will not be secreted in the stomach, so the enzymes will not be functioning properly. For example, pepsin and pepsinogen, which are required for protein digestion. Absence of bile, like for example, obstructive jaundice or infective hepatitis, that is jaundice, any other infections causing the diminished secretion of intestinal juices. Malnutrition itself suppresses some enzymes. So it's like a vicious cycle. There is a malnutrition, no enzymes, again malnutrition. So this is called as a bad cycle, vicious cycle. Next causes regarding the marasmus are the absorption. Let us see over here. Impaired absorption, not proper absorption. Low-grade bowel infection, including the giardiasis. This is because of the impure or the contaminated water, polluted water. Milk allergy may be there. Lactose intolerance. Lactose is a sugar in the milk. Celiac disease, any disease that causes the prolonged diarrhea and or vomiting, either together or independent. Absorbed but cannot be metabolized satisfactorily. Localized infection may be there. A hepatitis, inflammation of the liver, urinary tract infection, pus cells in the urine, burning of the urine, generalized diseases like tuberculosis, very common, chronic infections, metabolic disorders, diabetes, and hypothyroidism also can give marasmus type of the problems. Now let us see the last but not least, metabolized but not properly utilized, child of low birth weight born at a time, brain tumor, mental retardation, and chronic renal diseases. So all these makes the the scenario for the causes of marasmus. So one has to take care of ruling out one by one some investigations and rule out the causes. First investigation that you can do for any disease is hemogram and ESR, where you get the hemoglobin percentage, normal 12 to 14 gram percent, but it is less than 10 gram percent or 11 gram, that is can be anemia. Then there may be white blood cells which are soldiers. There may be increase in the count, that is 4,000 to 11,000 per cubic mm. White blood cells are normal. When it is above 15,000, 20,000, above, then there is a mild, moderate, severe infections. You can all take care of these investigations by looking proper figures. Then there is ESR. ESR is always not a diagnostic but a prognostic test. Whatever the infection like tuberculosis, whether it is getting cured or whether it is not getting cured, that can be examined by looking towards the number of ESR, okay, erythrocyte sedimentation rate. Urine, to rule out the urinary tract infection, whether there is a lot of pus cells in the microscopic examination of urine, that you have to see. For the stool, you can see the amoeba, you can see the giardia, ova, cyst or roundworm, threadworm, hookworm, tapeworm, all you can see in the stool examination. Blood urea and creatinine, these are very specific tests to assess the kidney function, renal functions. LFT, can you see over here? To assess the liver functions. Chest X-ray PA view, of course, for the tuberculosis, sonography or CT scan, if indicated by clinical signs and symptoms, rule out the cause. That means you have to tackle with the cause and then the symptomatic treatment. For example, here are some medicines that you can use for the marasmus disease, infantile muscle wasting. Calcipral, Ayurveda Shala Pune, 2 tablets 3 times in a day. It contains the natural calcium like the coral, etc. Shatavari Kalpa. Shatavari is also natural calcium. Asparagus racemosus, sugar granules are there. 2 teaspoons 3 times in a day with milk. Ashwagandha Rishta. Ashwagandha is the best plant for strengthening of our muscle tissue. That is a Withania somnifera, also immunomodulator. 3 teaspoons with equal amount of water with meals. Kumari Asava, number best medicine for liver tonic. Or Arogya Kada of Hari Parshuram Aushadhalay, pharmacy from Khadiwali Vaidya in Pune. 3 teaspoons with equal amount of water before meals. Then Alpitone syrup, 2 teaspoons 3 times in a day. Chavanaprash or Alprash by Allersin Company, 1 teaspoon 2 times in a day. Now, regimen. First, you have to see that, make sure that the patient has plenty and wholesome food. Okay, complete food should be there. Exposure to the monitoring morning sun, vitamin D, absorption of the calcium and making the bones strong. Then fresh air should be available. Have enough rest and moderate exercise. Regular massage with one of the following oils. You can use the Ayurveda Seva Sangha Nashik Abhyanga Tail, then Shatapaki Bala Tail, Ayurveda Arya Vidya Shala, then Kshira Bala Tail, Dhanvantaram Tail with Bala Sida cordifolia, then Mahanarayana Taila from Shatavari, that is asparagus racemosus, and Sahacharadi Taila for the lower extremities. My dear friends, in this particular video, we have discussed a lot about marasmus or infantile wasting. I hope that you have liked this video. Please don't forget to share and subscribe my YouTube channel and press the bell button icon to get the intimation of such interesting scientific but simple language videos from Professor Deshpande. So I wish all the best. Thank you very much for your nice support and cooperation. Take care and see you soon.